Who is at risk of getting preeclampsia? Any woman who gets pregnant has the potential to get preeclampsia. However, the following categories of women are at a higher risk of suffering from preeclampsia when they are pregnant. Women who are carrying a pregnancy for the first time, those are prime gravidas. Women who had preeclampsia in a previous pregnancy. Women who are too young, those who are less than 20 years, and as well, those who are too old, those more than 40 years. Then women who have a family history of preeclampsia, either the mother or the maternal aunties or the siblings. Then women who already have high blood pressure before getting pregnant, that's chronic hypertension. Then women who are suffering from long-term diseases like diabetes mellitus, kidney disease, as well as sickle cell disease. Women who are obese, too much weight for the person's height. Women who are carrying 2 or more fetuses, those are multiple pregnancies. Women who delay for more than 10 years to conceive after previous pregnancy. Women who are carrying an abnormal pregnancy without a baby, that's a molar pregnancy. Women who have a new partner fathering that pregnancy. Women who conceive through assisted reproductive technologies, for example, IVF. What symptoms do women who suffer from preeclampsia exhibit? A number of women who get preeclampsia may not show any symptoms, but if they go to a facility, for example, if they go for their routine antenatal care visits, they'll check their blood pressure and it will be elevated. They'll also check their urine and they'll find that there are proteins in the urine, but when they are not having any symptoms. And then those who show symptoms may present with the one or more of these symptoms. The other one, this one example is persistent and or severe headache, while the other one is visual disturbances like photophobia, that's fear for light, blood vision, temporary blindness, then upper abdominal pain, or what we call epigastric pain, altered mental status, that's confusion, altered behavior or agitation, dyspnea or difficulty in breathing, swelling of the face, hands and feet, nausea with or without vomiting, excessive weight gains or sudden increase in weight, which is more than 5 kilograms per week. Is there a cure for preeclampsia? At the moment, the ultimate cure for preeclampsia is delivery. There are also treatments to minimize some of the complications that could occur as a result of preeclampsia. The treatment that we can give to reduce the blood pressure, and then the treatment that we can give to control the seizures or convulsions. What are the immediate and long-term consequences or complications of preeclampsia? Complications of preeclampsia to the woman include convulsions, fits, or seizures, and that is when it becomes eclampsia. Then we have stroke, kidney failure, bleeding from the birth canal before delivery, that is abruptio placenta, or separation of the placenta from the womb. Then severe bleeding after delivery, that's postpartum hemorrhage, fluid retention in the lungs, that's pulmonary edema, liver failure, failure of the clotting system, that leads to uncontrollable bleeding, and then maternal death. What are the immediate and long-term consequences or complications of preeclampsia to the baby? Immediate complications to the baby include premature birth, being a stillborn or a stillbirth, that is the baby who dies before delivery, a bone too small, probably the weight of less than 2.5 kilograms. And then long-term complications to the baby include increased future risk of long-lasting high blood pressure.